Welcome to Health Matters with Lynn Szabo, PA Lynn Szabo. What are we going to talk about today?
Polycystic Ovary Syndrome, a request from many. So something I've never really thought about before, but it's exciting and there's new ways of looking at it. So it's worth talking about. It's the most common endocrine problem of women in reproductive age.
Okay, wait. Endocrine, what?
Oh, sorry, endocrine. Endocrine means hormone problem.
Okay.
Yeah, of reproductive age and a leading cause of infertility. It's more a metabolic syndrome. So the problem is in hormones, but not necessarily the sex hormones. It's more the pituitary hormones and hormones that regulate insulin control in the body, things like that. They're just starting to figure this out. So it's a metabolic syndrome that includes insulin resistance. So it's hard for the body to get insulin from the bloodstream into the cells where it needs to be.
So would that be like type 2 or type 1 diabetes?
Not yet. It's a kind of a precursor.
Okay.
It's like the first step toward that. Fatty liver, which means, the liver is an encapsulated organ, so it has a membrane around it. And when it gets fat deposits in it, that increases the volume of the liver, and the encapsulation doesn't really increase. So the liver gets squished.
Ew.
Yeah, fatty liver.
Sound very comfortable.
Yeah, and it's actually potentially fatal. There are people in this county that have passed away from it.
From fatty liver?
Mm-hmm. So about 40 to 55% of women with PCOS also have this liver abnormality. So it goes along with it pretty commonly. And like you kind of alluded to, it comes with an increased risk of type 2 diabetes. That means it's not that the pancreas isn't making insulin. It's like the insulin doesn't work very well. And then it can't cross over from the bloodstream into, say, the brain cell or the muscle cell where it needs to be, and it builds up in the bloodstream. So that's what type 2 diabetes is.
Okay.
But this actually affects about 6% of reproductive aged women worldwide. And that's a lot.
That's a huge number.
Kind of the same in the various countries. So there's no real difference between, let's say, a white woman living in the United States as opposed to maybe a woman of color living in Africa. It kind of holds at that 6%.
What causes this?
Well, they don't know. See, that's why it's kind of so cool. That's why we can geek out on it. It's kind of a mystery. And
cool for your science brain, not cool for the rest of us.
Yeah, I know. Not cool to live through. But there's a manifestation of this syndrome that also affects men. So these kind of endocrine abnormalities, not sex hormones, but metabolism type hormones also affects men.
So men can get PCOS as well?
No, they don't. They don't have ovaries, but they get the metabolic syndrome. So symptoms in men include increased hairiness, except premature baldness. It's kind of interesting how it's more hair, but not on top of your head, and changes also in insulin sensitivity, which is a big deal. But symptoms in women include irregular menses, so periods are irregular, acne, which is super annoying, elevated blood pressure, obesity, and that's kind of a chicken and an egg thing. So the weight goes up, that makes the syndrome worse, and then the weight goes up because the syndrome's worsening. So it's a chicken and an egg problem.
Gotcha.
Hirsutism, which means hair in places that you don't want it. Okay. So usually for women, that's facial hair. And problems with reproductive abilities because eggs aren't being released from the ovaries at the right time. So it makes it hard to conceive. So I think at this point, there's kind of an important side. And it's important to look at what syndromes mean in medicine versus disease. Okay?
There's a difference?
Yeah. Okay. So a disease is a clear-cut problem that has a clear-cut cause and a straightforward solution. So you got strep throat. That's a disease of the throat that's caused by streptococcal bacteria. And the way to take care of it is antibiotics. So pretty straightforward. But a syndrome is a variety of symptoms that could have multiple causes. And that might be present in some people and not present in other people. So it's not as clear cut. It's kind of like sorting out a waterfall. It's hard to see what drop is this, what drop is that. And treatment becomes less straightforward. So super difficult.
So how do women get treatment, especially if it affects fertility?
Yeah, we're going to talk about that in a little bit.
Okay.
But the main observed problem in PCOS is an elevation of androgens. So these are male hormones. And all of women have androgens to some extent, but there's a relative elevation of androgens compared to levels of estrogen. And so that's why they get the beard hairs, and that's why their periods stop.
Okay.
Yeah, and it's probably even more complicated than that, and the effects are widespread in the body. So we've talked about the insulin resistance, the hair, the irregular periods, and that exact cause is unclear and probably genetic. That would explain how men can get it too.
Okay.
So they're kind of honing in on it. My guess is it's not going to be one gene. That's the bad player. My guess is it could go a couple of different ways. And the thought is that because of this genetic problem, that there's a problem with the communication between the pituitary gland and the hypothalamus. These are two parts of the brain. This kind of highlights what I've spoken about before, that when somebody comes in and asks for their hormones to be done, and medicine says, what do you really mean by that? There's thousands of choices. The most important players here are actually the communication, which is hormonal, between the pituitary gland and the hypothalamus, so between two different parts of the brain.
What exactly are they communicating? Like, we should meet up here for lunch? What's going on there?
Well, for example, the pituitary kind of controls weight, metabolism, speed of metabolism, but it also controls the hormones that go into a woman having a monthly cycle. Okay. And it also controls, there's a lot of other things. We could talk forever on that one. Pituitaries are underappreciated. And just to make everything more confusing, pituitaries have an inverse relationship with a lot of thyroid hormones especially. So there's feedback loops. So sometimes having too much hormone might mean that not enough is happening. And it's super confusing.
So if you have this all going on and it's all hormonal and it's, is it something your normal primary care physician can do?
Yeah, that's a good start.
Do you need extra care if you have PCOS?
Eventually, maybe, but some of the most exciting things actually can be done at the level of the primary care. So I think it's important to get a primary care provider who understands the changing understanding of this syndrome and also the changing treatments that are recommended. Not everybody's treatment is going to be the same across the board, but there's some commonalities. So initial testing should include measurements of hydroxyprogesterone, so one of the progesterone hormones that women have, prolactin, which is the nursing hormone, thyroid stimulating hormone, again coming from our friend the thyroid, oral glucose tolerance test, and any pregnant woman remembers this one. It's where they come in fasting and then they drink this really sweet liquid and get a big sugar load in their body and then see how their body handles it. Not a very fun test, but not horrible.
It's not good.
No. Fasting lipids, which is just fasting cholesterol panel. And most women will have a pelvic ultrasound done as well, although this isn't actually the most important part of the testing. And the goal with the pelvic ultrasound is to look on the ovaries and see if there's the characteristic cyst pattern. So a cyst is a bubble, with a fluid-filled bubble. And then when you look on the ovaries in PCOS, there's a bunch of tiny little cysts, and there's no one dominant cyst. Okay?
Okay.
When women ovulate, normal ovulation involves a cyst, and that's an example of a cyst that's normal. So a single dominant cyst kind of develops out of a cluster of 2 or 3, and then it breaks open and releases the egg. And most women don't feel it, but some women feel it pretty intensely. But all women get confused about whether a cyst is something to be concerned about or not concerned about. And it really depends on the context of the finding. But a lot of women come in and will have an incidental cyst found on an ultrasound, and they'll be quite worried about it. A cyst is part of normal ovulation. We all first spring forth from a cyst. Okay.
So that sounds kind of gross.
Yeah, it could be. So all ovarian cysts are not bad things. In fact, the vast majority of them are no big deal. I mean, they happen, 2 or 3 of them happen monthly.
Okay.
And then one becomes dominant.
That's where life starts. Got it.
There you go. And physicians also look at insulin-resistant component and the component that can lead to type 2 diabetes and to fatty liver. And the number one treatment, the place you start for all of this, not even depending on what the actual cause is losing weight is important. And you have to have a provider who can tell you that in a non-shaming way, which is not super common. It's really a hard thing to deliver a message like you really got to lose weight for this to be addressed.
Right, especially for women, right? Our identity is so often...
Right, and what that sounds like.
And how we look, and our mental health, it all correlates together. How do you go about, as a PA, I'm sorry, I'm going to go way off the topic here.
Yeah.
How do you, as a PA, go about talking to your patient when they have a syndrome, symptoms, one of the things that you said that's not a disease, that causes weight gain, and then tell them your illness causes your weight gain, but you have to lose weight?
Right.
Because it doesn't seem... I would view that as frustrating.
It's very hard.
This is your illness, and it causes you to gain weight and give you fatty liver, but now you have to lose this weight.
Right. Super helpful that my body mass index is probably about the same as everybody else in Del Norte County, and right now it's more like 30 or 31, but I've been up to 37. So I think it's helpful if you're not super thin, okay? Because then you can deliver the news kind of in a, like, we're all there. Okay. I totally understand, how this feels. It feels terrible. But I also know that the number one thing you need to do to feel better is to lose weight. And if this woman is looking for a pregnancy, that can be kind of motivating. And we're not talking about drop 100 pounds. In some women, this disease or the syndrome process will start to reverse itself at a loss of about 5%.
Okay.
Yeah, so that's like 10 pounds.
How do you go about, so now that you've told the person, how does the patient go about having an illness that causes weight gain? How do you lose weight when what's making you sick makes you gain weight? You
have to start with diet and exercise, and that always sounds disrespectful when you say that in the exam room. So I give everybody the same parameters. 150 minutes of exercise a week, and that doesn't mean going to the gym and pounding it out, although you could do that. That, for me, that meant walking my chihuahua. Okay. And so 150 minutes per week. And then a reasonable diet. And I usually recommend the Mediterranean diet because it can be so varied and because it's sustainable and it's not extreme. And then sometimes if people are interested, I'll talk about intermittent fasting. But I don't say go keto and all that. I don't think that's sustainable. I think a Mediterranean diet, which is also is called by a lot of names, but a DASH diet, so dietary approaches to stop hypertension. These are good cardiac health diets, and that's an important part of this. Okay. So if you do those two things, then I think you're really starting, but you can't do it for like 10 days and then be mad because you gain 3 pounds. You have to know that this is how your life is going to be.
So it's a life...
Right.
That becomes your life.
Yeah, it becomes your life.
Not and then just a diet. This is a life choice.
And then don't become angry and frustrated and quit because you don't feel like you're losing weight fast enough. The next thing to do is, how do I modify this foundational approach to start to lose more weight. Maybe I got to do 180 minutes of exercise a week. Maybe I've got to do a Mediterranean diet, but add intermittent fasting on top of that. So, it becomes sometimes as simple as just, okay, I'm not going to drink any more carbonated soda. And, that's hard for a couple of weeks, and then you kind of get over it and you're drinking water. And that, boom, all of a sudden you lose 30 pounds.
Wow.
You got to find the key for you.
So each individual kind of a thing.
Yeah. And everybody kind of has to think about it as a long-term commitment and not something you're going to do for a short period of time.
So for you as a PA, you look at exercise as anything that gets you up and moving, whether it's playing with your kids at the park and running around with them, coaching the soccer, walking through the woods, swimming at the beach, surfing, all of those things.
Right. You got two 8-pound weights at home, and when you're watching TV, you're, doing some reps. And for 10 minutes, that's exercise. You go on YouTube and check into one of the, 10, 20, 30, 45-minute videos on yoga. I like our pod at UHS does yoga with Adrienne because she kind of laughs at herself. And she's got such a diversity of videos that sometimes you can really sweat and sometimes you can just be the old lady doing chair yoga.
Nice.
And sometimes you could do yoga for inner peace, or sometimes you can do yoga for cardiovascular health.
So that's yoga's not Tai Chi, all those things. That's not woo-woo. Those are actually effective forms of exercise.
Those are really, really helpful.
Okay.
I think. And there's a wide variety and it's free. And you don't have to get in the car on a rainy night and go to X, location to be at the gym for 45 minutes.
Okay.
So, but one thing that we have in Del Norte is our pool. Super great gift. And our pool has been redone. And if you're a UHS patient, then Wednesday night is UHS night. And I would encourage Del Norte Community Health to sponsor a Del Norte Community Health Night where people can go for free. And they have an aerobics instructor, they have lap swimming, and then they have water walking, which is just gossiping. You just get a girlfriend and you're like, I cannot believe he said that to her.
Oh my goodness, I need to do that. That sounds like
I would totally need to do that. And everybody, once they get in the water, looks the same in a bathing suit, okay? So don't give me that one. So further treatment depends on the goal of the woman. So if the woman's goal is to focus on fertility, then treatment goes into a fertility preservation direction. Okay, and that might mean adding on metformin, which is a well-known diabetes and pre-diabetes medication. And if with also the goal to put people on statins, this was one thing in my research I saw as an emerging treatment. And can I make it clear as an aside, we do not get paid for writing prescriptions for statins. Okay, statins are drugs that help lower cholesterol, and they're, some brand names would be like Lipitor. Atorvastatin is the generic name. I have no financial interest in this, but I find it interesting that they're using this to help kind of change the metabolic situation so that women can step away from this particular syndrome. I don't think statins are great if you're seeking pregnancy, though.
Okay.
But one thing we've noticed with the Ozempic and Ozempic-like drugs, GLP-1 drugs, is that a lot of women are getting pregnant kind of unexpectedly. And so maybe as they lose weight... With
Ozempic, they're unexpectedly getting pregnant.
Yeah, not necessarily that particular drug, but one side effect of losing weight, even a small amount of weight, can be a return of fertility. And so I think they're heavily looking at these drugs to treat a lot of different syndromes that are attached to problems with weight. And I think that's going to be super exciting because a lot of women who want to lose weight, their insurance company won't pay for weight loss drugs. But if you can say, hey, I'm doing this because I have sleep apnea, or I'm doing this because I have PCOS. So you take it like a step away, attach a specific known syndrome that weight loss would benefit, and then you can get the medication that way.
So you have to basically prove to the insurance company that it's cost effective to help them lose weight now so they don't have to pay more money later?
Well, they know that, but the way that they're looking at it is you're going to lose, you're going to change your job and not be their problem by next May. Okay, so they're not too worried that you're going to have a heart attack when you're 60 if you're 30 and job hopping.
Gotcha.
So I think what you have to prove to them is the FDA finds this treatment for, let's say, sleep apnea to be helpful. And in this case, Mounjaro is been FDA approved in treating sleep apnea. But what are you really doing? You're just helping the person lose weight. And then the sleep apnea, all these problems become kind of like magically gone.
Wow. And are you talking substantial amounts of weight again? Or are you just talking as
5% of body mass? So in a 200-pound woman, that would be 10 pounds? That's not a huge amount of weight.
Wow.
Yeah. And so, women are so used to, I can't look good in these jeans unless I lose 60 pounds. That's not really what we're talking about in medicine. So if your provider is talking to you about your need for weight loss, first of all, don't take it personally. And second of all, ask your provider what there is available to help you with that.
Okay.
And don't fall for phentermine because it's not really a solution. There's so many better choices out there.
What did you... for what?
Phentermine is Fastin. It's part of fen-phen. Do you remember fen-phen?
Yeah. That's why all of these things scare me, is because of the fen-phen.
The fen-phen thing hurt a lot of people.
It's fatal for some.
I had about 40 people on it, and I think about all of them gained their weight back. It was really kind of fast. It was really heartbreaking. But also people go into weight loss medication. They did a lot at that time thinking, well, I can eat anything I want and I don't have to exercise.
So fen-phen wasn't causing the pulmonary hypertension and
it was causing it.
Okay.
It was causing it. And out of the 40 I had on that particular medication, I think 1 or 2 ended up having problems with their heart valves. So it wasn't a really unknown problem.
Okay.
And it was super exciting for a while. And and then it was awful. And I kind of keep thinking the Ozempic-like drugs, I'm kind of waiting for the other shoe to drop, but I keep reading studies that are really exciting, super promising.
Has it been out long enough that we will know if it's going to cause permanent damage the way fen-phen did? And then
it's been out longer than fen-phen has.
Oh, okay.
Yeah. So, and they keep finding positive things about it. I'm not saying it's everybody's solution. Again, you have to go back foundationally to diet and exercise. There's plenty of people who are on Ozempic-like drugs and who are not doing the work that they need to do.
Okay.
You can't get away from that. You got to go out and walk your dog.
Okay.
And, they're staring at you.
All right, note to self, buy a dog.
Yeah, that's right.
My cats won't be happy, but I'll get a dog.
A slightly needy dog.
No, never mind. I'll just stick with the gardening.
Yeah. So I think with PCOS, if somebody has that, there's a lot to be excited about right now.
Okay.
There's really a lot changing. And I think you have to find an inspired provider. And it's usually the women's health providers. And anybody at UIHS can come talk to me if they want. I have a renewed excitement about tackling this problem.
Okay.
So, yeah. It's not a problem I ever had, but it certainly, I see enough people with it. So thank you for requesting that, Amanda. I hope that answers some of your questions. But I was thinking about what I said last week about what I was going to talk about this week, but it's such an ongoing horror that I've kind of postponed it till next week, and maybe even longer, but that's Department or the Secretary of Health in the present administration, Robert Kennedy Jr., and how the guy who apparently wasn't an anti-vaxxer is acting a lot like an anti-vaxxer, and how's that going to affect us here in Del Norte?
I don't care how many times people want to say that he's not an anti-vaxxer, and he stands up and says that he has gone globally against vaccines and caused harm. I mean, look what he did in Tonga. It's ridiculous. And I get frustrated. Why do we have an environmental lawyer overseeing this?
Yeah.
He has no medical training whatsoever.
Right. But people think medicine ought to be the way they think it should be. And then they don't necessarily embrace science. It's whatever kind of feels logical to them or fits in their political worldview. And they think that's medicine. The big news for you folks, science doesn't care what you think. Science is. It just is. So I kind of understand like what you're saying, right? Like I asked about the woo-woo with yoga earlier and those types of things. I'm one of those people that's like, well, let me try to do it on my own first before I have to take medication long terms to manage a health issue, to do those types of things. I think that we have a lot of loss of nutrients in the food that we produce today because we produce it for shipping instead of for flavor and for nutrients. Right. The loss of nutrients in our soils, the salts that we put into them. Right. There's some science behind this, but to me, there's a lot of that's the old wives' tales of we didn't have these issues before, but we ate better. Right. Most of us people had a garden growing up, and you canned food, you preserved food, you didn't rely on the grocery store the way that we do today. So where do we put those things together? Because some of the things that he says, I kind of agree with. And then there's other things that he says, and I'm just looking at him going, that defies any level of common sense, let alone critical thinking. So where do we find that balance? And is that how they get away with the lies that they tell? Well, I think you got to even take a step backwards and look at a more complete picture. What are you doing when you're gardening? You're exercising. As women, we focus a lot on eating, but I think eating is the important thing if you had to look at two of them. But if you're not going to eat because nobody's, setting the garden up for the spring, then, you're missing out on a really important part of what's going to make you better. So moving makes people better. Okay. And, but I think we also have to recognize that science changes over time. And what
does it change, or do we just actually learn and understand it?
Yeah,
better?
We learn more. Okay. I mean, it might change a little bit with changing conditions too. I mean, this is multifactorial. Okay. But I think I think you're right. That feels intuitively obvious, but I don't have the data, and I couldn't tell you if it was the real thing. But I think getting up and moving and eating out of your garden because you've produced like this wonderful produce is a great thing. Okay. That's why I have bees. Not because I'm ever going to eat the honey, but because they do well, for other people's yards and stuff.
What do you do with the honey?
I don't know. I haven't harvested it. I'm only an apprentice. But,
okay.
But I'm just trying to keep them alive right now.
Okay, so you think there should be a Garden Matters?
Yeah, and it should include things like bees, because I'm currently obsessed. But bats and soil, how do we have a healthy soil? And, maybe that could go into fishing, and maybe that could go into cultural, practices of getting food from the earth. There's just all kinds of directions I think that could go. Now, I'm not a gardener, but I'd be glad to help.
I'm an amateur gardener. I mostly grow because, my area is small, so I mostly grow in container gardening. I have a few things in ground, some perennials and things. I'm learning about grafting with fruit trees, but yeah, I just play and dabble. I think this is a good idea. I think we should do it. So let's work on that this week and see what we can put together in the coming months.
Will do.
So this is not Garden Matters. This is Health Matters with PA Lynn Szabo. And we'll see you next week, and thanks for joining us.
Will do.